Welcome to Coffee with Dr. Stewart. This show will provide our listeners up-to-date medical information from a leading neurologist and neuroimmune specialist. Your host is Courtney Stewart, and your medical expert is Dr. Kendall Stewart. So grab your favorite beverage or cup of coffee, and let's have Coffee with Dr. Stewart.
Hello, everybody, and welcome back to another episode of Coffee with Dr. Stewart. I'm your host, Courtney Stewart, and today we're going to be bringing you a discussion on fatigue. But first, I got to ask Dr. Stewart, Dad, how are you doing today?
I'm great, Coco. Thanks for asking.
Are you ready?
Yeah, I'm ready. Sure, I'm always ready to talk.
Yeah. What about anemia?
Anemia is kind of the same way. You know, it's about delivering energy, okay? And so obviously oxygen plays a huge role in most of our metabolic processes. And so the problem with anemia is that we kind of understand that it's actually hormonally based. And there's kind of a catch.
A lot of teenage girls that have anemia.
Well, the problem with women is once they start cycling, you're losing blood every month.
Yeah.
And so when you're losing blood, you got to replenish it. And if you're having fatigue, energy crisis in the body, you don't really have the energy to replace that blood. And so, that's a lot more complicated process. That's why we have specialized doctors called hematologists.
Mm-hmm.
You know, they play into that, and we know iron plays a role. We know energy plays a role. We know oxygenation expectations, altitude plays a role. I mean, there's all kinds of things that play a role. But in general, when we see anemia, we know that person is not healthy. They're not feeling good.
Mm-hmm.
Makes sense? Because all the physical activity takes a lot of oxygen. So you remember when we measure exercise, we measure VO2 max, which is the volume of oxygen delivery.
Mm-hmm.
Okay? And so obviously the less amount of blood cells you have, the less oxygen delivery, the less your cells can actually keep up.
Yeah. All right. What about inflammation or chronic inflammation? I know we did a whole podcast on inflammation, so we definitely encourage y'all to go back and listen to that. But I wanted to see if you can dive into
this. Is what I call pathologic fatigue.
Okay.
And what I mean by that is there's physically something wrong with you that's actually sucking all your energy out.
Okay.
Do you understand?
It's kind of, is it anything like the toothpaste tube analogy?
In a way, it really is. Now, that really happens later in it, because once you feel sick,
mm-hmm.
I mean, nobody feels good when they're sick. Okay. The body is going through mechanisms to do its best to fight off this infectious process. Okay. So fever, we know actually raising body temperature actually sucks energy off.
Yeah.
The metabolic rate goes up. We also know that, your immune system is a very major organ. When it starts requiring a lot of energy to do what it does,
mm-hmm.
you're going to take a lot of energy from other places, because the body, in essence, only has a certain amount of energy. And I like to call it buckets.
Yeah.
Okay. And what I have is 4 buckets at different levels, and one spills into the next. So we'll always protect the bucket that basically has us living life, our heart
mm-hmm.
beating and everything. We'll always protect that.
Yeah.
And then if we have enough, whatever of what we're talking about, it will spill into the next bucket. And that bucket is actually the immune system. Okay. And then once that bucket is healthy, because the immune system protects you from things that will threaten your life and keeps you from getting so sick that you die, because
mm-hmm.
that's ultimately what the organism wants.
Yeah.
And then it will spill into basically growth and other things. So if you have kids that are chronically ill, they don't tend to grow.
Yeah.
So what I call required but accessory things. I mean, literally, if you have a child that's chronically ill, they don't grow.
Mm-mm.
And then the last is the cognitive bucket, which means that's dopamine, serotonin, and all the neurotransmitters working well. And I like to say that if you're ever sick, you don't think and focus very well, because your bucket, it's not spilling over to the next. And so in general, those buckets tend to help me kind of understand where I need to go. But autoimmune diseases, inflammation of various sources, whether it's genetically predisposed or triggered by something,
mm-hmm.
infections, Epstein-Barr, yeast, Lyme's disease, all the co-infections. In
Yep.
fact, that's another thing. We are not seeing a lot of Lyme's. We're seeing a lot of co-infections from Lyme's.
Okay.
Then we have cancer,
Mm-hmm.
and we have other things that are causing pathology in the body. And that pathology is threatening the body's health or existence. And so I believe in that scenario, the fatigue is actually the protective mechanism to store up enough reserve energy
Okay. Yeah.
that I don't actually expire from the pathology.
Okay.
Does that make any sense at all?
Yes.
Okay.
Yes. Yes, it does. What about some different medications that might cause?
Well, and that's another thing. So medications cause fatigue all the time. And, it's really the hardest thing as a physician. Pharmacists try to help us with it, but the hardest thing with a physician is, remember, almost every drug that we use is broken down by a specific liver enzyme. And those liver enzymes, we have different inheritance, and sometimes they're weak. Sometimes they're actually super good. So we have ultra metabolismers, we have normal metabolism, and we have poor metabolism. Then we have moderate metabolism, then we have poor metabolism. So the problem is, if you're using drugs that you're used to using, especially in people who have a lot of drugs, it's very hard to recognize, unless you're just thinking nonstop, that maybe I have 2 or 3 drugs that are actually being processed by the same enzyme, and I'm affecting the way they metabolize.
Okay.
And then a lot of people never get their genetics for their liver enzymes anyway. So basically, I would say it's accidental overdosing, not intentional.
Yeah.
But drugs themselves can have lots of effects. The psychiatric drugs are meant to slow the process down.
Mm-hmm.
Do you understand?
Yeah.
They're meant to calm the process, and it's very hard to calm the brain without calming the other parts of the nervous system.
Yeah.
We have drugs that slow the heart rate. We have drugs that relate to blood pressure. And if you get too much of any of those, you can really have fatigue. So I should have mentioned that at first, because when you go to see a doctor, he needs to think about that first.
Yeah.
Probably.
Yeah. And so by accidental overdose, you just mean that basically you don't have enough enzymes, or your enzymes don't have enough energy to be able to break down the different ones,
So
or
they
is
don't
it
break it down as
or...
fast.
Okay.
And so basically, we can't give a standard dose, because then that will become toxic.
Okay.
Do you understand?
Yeah.
So what happens, we call it competitive inhibition, meaning that if we have 3 drugs that are using the same enzyme, they're interrupting the breakdown of the other ones. You'll learn about all that.
Yeah. I'm waiting for PA school. Okay.
Absolutely.
What about some different vitamin deficiencies that you can have? Or what are like some main vitamins that could be missing that can then cause fatigue?
Well, without a doubt, the 2 biggest are methylfolate and methyl B12.
Okay.
Remember, those are water-soluble vitamins. The problem is getting through membranes and getting into certain areas of the body requires them to be converted, and that conversion can be messed up a lot.
Yep.
So folic acid and folate to methylfolate, B12 to methyl adenylyl B12. Very important in a lot of different things. Now, genetically, we have basically a genetic panel that can tell you exactly how good you do every single vitamin.
Mm-hmm.
So you don't have to guess anymore. And it tells us about the absorption and the transport of the vitamin and whether we need it or not. And so I'm always going to go to genetics for that. The problem is, did you know like a multivitamin is probably the biggest waste on the planet?
Really?
And the reason is because if you have a genetic weakness or an acquired weakness, because sometimes you can take certain drugs or eat certain things that will deplete your vitamins, there's never enough in a multivitamin.
For what you actually need.
Yeah, I call it window dressing. We say it's in there, but there's just a little bit.
Yeah.
And so it's never concentrated enough to give you a real physiologic effect.
Okay.
So that's why, I used to fuss at Mom for reading all the labels, because she's looking at how much sugar was in it. But you really got to read the labels on the vitamins, because remember, in more professional grade vitamins, we can only report the absorbable amount
Yeah.
on the label, versus when you go to the food grade vitamins, they report what's in it, but you may not absorb near that much. And in fact, it's usually not even close.
Okay.
So vitamins are a big deal. I would just say don't guess.
Yeah.
Now, we can tell from red blood cell size.
Okay.
So if you have an iron deficiency, your red blood cells will be small.
Mm-hmm.
If you have a B12 deficiency, your red blood cells will be very big.
Huh.
That's why we measure the MCV,
Okay.
mean corpuscular volume. How big is the cell? Methylfolate deficiencies can cause cells to be small. Okay. And so that's when your doctor looks at your blood count and says, oh, you might need some B12.
Okay.
Now, the problem is I will always give methyl B12. That's not the cheap form.
Yeah.
But I'm always going to give what we call the bioactive form.
Mm-hmm.
And so vitamins, the easiest way to do it for me is just to get a genetic test. It's not really expensive. And it's just a vitamin profile, and it'll tell you about vitamin A and vitamin E and basically the ones you need and the ones you don't. Now, the problem is you don't want 10 bottles over here that you got to take one every day.
Mm-hmm.
So we have some ways to work around that where we put things together.
Okay.
Like the same transporter for biotin also handles pantothenic acid. Lots of women take that for their hair health and their nails. So we can find out whether you really need it or not instead of just saying, oh, I think my nails aren't as healthy. Let me take this.
Yeah. And so that's usually through a blood test that you can find
Oh,
out?
it's a saliva.
Oh, no. Through genetics. Okay.
Now, you can measure it. They're okay. I like the genetics because it tells me how it's delivered.
Yes.
It's not just what's in the blood. Because remember, if you have trouble delivering folic acid, we check your folic acid in the blood, and it's through the roof because it's all floating around in your blood and not going into the cells. So everybody who needs methylfolate, their folic acid is greater than 20. So their doctor says, oh, you're overdosing in it. No, it's just not transporting.
Okay, so that's why it's important to take methylfolate?
Methylfolate. Okay.
Okay.
And remember, there's 5 steps to it, and so in our genetic reports, we measure
Each step. Okay. Yeah, and so while we're on this topic of identifying if you have fatigue, could you go into more detail about like what you could check on a blood test?
Sure, absolutely. So if you get back to the mitochondria and what it needs, we got to check your thyroid.
Mm-hmm.
We want to check, now I forgot to say oxygen is needed, so you do definitely want to check a blood count.
Okay.
Blood count will also tell you if your white count is high and whether you have an infection.
Mm-hmm.
Okay. Especially in more elderly people. I mean, they can have a urinary tract infection, not know it, and feel awful.
Yeah.
And the last thing you would think it's a urinary tract infection, and you'll find it.
Yeah.
Okay. You then have to check. I like to check their pregnenolone and their steroids themselves. A lot of my older women are on progesterone. My men are on testosterone. I like to have a glimpse at that.
Mm-hmm.
I do like to check infectious titers. So I like to make sure yeast is not there. And the reason I like to make sure yeast is not being exposed to your blood because nothing turns the immune system activation on more than yeast.
Why?
It's our innate immune system. The one you're born with from your mom reacts very heavily to yeast. And in fact, that's why breastfed babies typically don't get as many yeast infections, even on their skin, as babies who are bottle fed without the breast milk. So the innate immune system, yeast will really turn it on.
Yeah.
And I'm just talking about exposure because your gut's got yeast in it anyway. I like to check Epstein-Barr. I always check its cousin cytomegalovirus, especially if there's a history of cancers, because we do know certain cancers are tied to cytomegalovirus.
Okay.
You can ask about a history of shingles. You don't have to check that titer. Some people will check if the initial blood test is fine, you can go ahead and check for Lyme's and co-infections. My favorite test for that is the IGeneX.
Okay.
They literally take your plasma and they look at the genetic. They're looking for the genetics of the actual infectious agents in your plasma to tell you whether you really have it or not. It's a really cool test.
Yeah.
And then, obviously, you're going to want to test the liver enzymes and everything else to make sure you don't have hepatitis, you don't have pancreatitis. And then a lot of people, they will do microbiome testing. The problem I have with microbiome testing right now is that I don't think we know quite enough. because literally I could send a microbiome test out and it will show me 300 different bacteria, viruses, yeast in my gut, and I don't know which ones are really good and bad, and we're still actually working through that.
Okay.
So I like to really go based on bowel habits. If you have inflammatory bowel disease of any type, Crohn's, ulcerative colitis, celiac, you got to look at food allergies in some people. I mean, there's a lot to the history, and that's the problem. It takes time.
Yeah.
I mean, if you come to see me with fatigue, I'm going to spend 45 minutes with you just in learning what's going on, okay? But the standard blood test will help us to a certain degree.
Okay.
Now, here's the problem. You got to remember that normal range is not normal. Normal range is basically the mean for everybody they test. Okay. And 2 standard deviations above and below the mean to catch the 20th and 80th percentile.
Okay.
But the problems for most of those is they put 20-year-olds in with 70-year-olds.
Yeah. Yeah.
Okay.
Very,
now, what you need when you're 20 is not what you need when you're 80.
No.
And so if you're in the normal range, that does not necessarily mean you're normal. You can adjust it for age. I like to see somewhere around the 50th percentile to be happy.
Yeah.
And you got to understand that when you don't feel good and you're burning more, it will come down. And so you kind of got to be a little artistic in understanding labs.
Okay. What about genetic tests? I know you've already hit quite a bit on that. It can really just give you a clear picture.
It really gives you a clear picture. What you really want to know, especially in pathologic, is you want to know, how can I attack this inflammation? Because depending on what your genetics is, we'll use different prescriptive and natural agents to attack it.
Yeah.
And so in the immune system, which we haven't really talked about, there are basically 3 basic systems to the immune system. There's the JAK-STAT system, which basically works on chemical messengers. Okay. There is the tumor necrosis factor system, which basically stimulates a lot of inflammation no matter how it gets activated, but it's very commonly mutated. And then we have the toll-like receptor system, which actually activates with infectious agents that attack us. And so understanding where this patient has maybe an aggressive response gives us a better way to approach it to ultimately turn off that inflammation. Because in feeling good, the first step of healing anything is always inflammation control.
Yep.
Always.
Yep.
And then the second is delivering glucose.
Yes. So what genetic panels would you suggest if somebody is going through fatigue?
We have different genetic panels, meaning that I don't want all the genes because it will overload you.
Yes.
But in general, we've divided them into more symptomatic. So if you have more of a neurological process, we get a neuro panel, which does have some immune markers. If you have more of an autoimmune disease, we get an immune inflammation panel. So in general, we have different panels off the same test. The way we do it is we run 120 genes when we swab you and we put it in a database. But we only pull them out and make you pay for them when we use them. Mm-hmm. So we don't want to have to pull everything and just give you this big bill when you don't really need it.
Yes.
Okay. But it will guide you as to how to help, because otherwise you're really just, you're freewheeling it. You know? And I just don't prefer that. I like to be more targeted.
Yeah. When looking at someone with fatigue, would you ever suggest a sleep study test?
Absolutely. So when you deal with sleep, and this is a whole discussion I think you can do on its own, you're going to ask about obstruction. You've got to look at architecture, because a lot of times, not everybody that has sleep disorder snores. Okay, so you can look at snoring, and the classic thing from an ENT standpoint, we're taught that if you have too much obstruction, we do surgery with lasers and stuff, take your tonsils out and give you a bigger opening. But a lot of times it's really basically not necessarily obstruction. You'll have this little skinny person who's got obstructive apnea, and you're like, okay, this is not because their throat's closing off. Mm-hmm. So, a sleep study is required if you really cannot make a impact doing other things. So it's not my first thing to do, but if I cannot get that patient with even using supplements or even sometimes some mild prescriptive agents, I don't like the heavy prescriptive agents for that. But in general, if we can't get them sleeping better, I think a sleep study is indicated. Now, the problem is a CPAP does not let you, it does push air down your throat. It's not the most elegant device, okay? If you really have bad obstructive sleep apnea, it can feel like it's a life changer. But for a lot of people that wear it, they can't even tolerate it.
Yeah.
And so we've got some new surgeries out, or basically implantable devices. Okay. The Inspire is one of them. The Inspire basically kind of is under your skin as a little, like a pacemaker device. And you turn it on with a magnet when you're going to sleep. It has an electrode to your diaphragm and an electrode through your hypopharynx. And so what happens when you turn it on, when it senses an inspiration, it sends a signal and opens your throat. Yep.
That's cool.
It's called Inspire.
And so that's only if somebody has like really bad.
No, that can be anybody as long as you meet the criteria that we know are needed. This is a surgical implanted device. It's much more natural because you're really not just shoving air past the obstruction. You're opening it to get the air in. Not everybody qualifies.
Okay. And so now when looking at the treatment of fatigue, obviously lifestyle changes are a big thing. So fixing your sleep schedule, exercising more, looking at your diet. And of course, we've gone over a lot of this in previous episodes in our fitness episode and our nutrition episode. Now I'd like to look at what supplements could help. And obviously we tell that from a genetic standpoint first. So the first supplement I'd like to go over is Mitocell PQQ, or what's it called now? Daily Cell Recharge.
Daily Cell Recharge.
So what does that do, and how can it help with?
Okay, so what that is made up of is the mitochondria, which makes energy for you. You remember, you put in glucose and you get ATP out the other side. What it does is it answers in one supplement multiple steps within that mitochondria. So you've got the mitochondria makes hydrogen peroxide, which can be toxic to it, so it has to break down. So it has antioxidants in it to keep with the oxygen-free radicals. It has basically some superoxide to get rid of the reactive oxygen species. It basically has the quinolones, the CoQ10, and things you've heard of that help. And then what it really has that works great is called PQQ, which is pyrroloquinoline quinone. That is the only substance that has actually been shown to tell a cell to grow more batteries. So genetically, you inherit your batteries. I can't fix that. That's what they are. But that doesn't say I can't grow more batteries in every cell. Okay. So PQQ, I think, is a must in fatigue because I've got to get your batteries creating more energy no matter what I'm doing. Whether I'm healing you, whether I'm controlling inflammation, whether I'm trying to get you to sleep and your brain processes properly, remember, energy is one of the keys.
So it's not so much about changing your batteries, it's about growing more to
cleaning them out and recharging
them.
So we also look at chemicals. We'll look at your detox system and your genetic testing to see whether something like a glutathione IV could actually wash those chemicals out to strengthen it. I mean, there are some people that have fatigue. We give them 1, 2, 3 glutathione IVs, and they just feel tremendously better. Now, that could be anti-inflammatory. It can be washing the chemicals out, recharging, allowing the batteries to work properly. It's just a lot of different things.
Okay, so the next supplement I'd like to go over is neuroimmune infection control.
So basically, kind of interesting story. Did you know that you probably have never known that actually grapes had seeds?
I know.
Okay, well, you might not have ever had one with a seed. You understand? Or, you may have typically had these foods that we call hybridized to get rid of things that people didn't like.
Like watermelons with seeds in them.
Well, and if you remember, you probably don't, but back when I was a kid, if you bought a plum at the store, it was covered in chalky material. That chalky material is a natural antifungal called caprylic acid. Okay? And what it's there for is so that when it's ripening in the wild, it actually will stay ripe longer because the yeast doesn't get on it and take advantage of it. And so what happened is I realized there's a whole lot of things we had taken out of our foods that really have wonderful benefits for your gut and for your health in general. because God built in these foods things to control bad
Yeah.
bacteria and other things in your body, bad yeast, etc. And so what I did is I took most of those and we put them back into a single capsule.
Okay.
So there's grapeseed extract, grape leaf extract, olive leaf extract. Do you understand?
Yeah.
And things that we've actually removed from a lot of our foods, caprylic acid, and we've put that back into a single capsule that you take to help control long types of infections.
Okay.
So it's really kind of for healthy people. It's not going to fix an infection.
Yes.
But once you get there, it's going to help you keep yourself
yourself
much
good.
healthier.
Yep.
Really good for the gut biome.
I know we've talked a lot in previous episodes about DCI cell recovery. I wanted to see if you could go deeper into
Sure.
fatigue.
So remember, glucose drives all energy.
Yes.
And so insulin delivers glucose. That's why insulin resistance is such a problem. And that's why people with insulin resistance are tired.
Yes.
Okay. And diabetics are all tired. So when insulin hits a cell, it's basically telling that cell you need to take up glucose. Okay. Well, the glucose channel sits over in another part of the cell. So we have to have a signal go from that receptor to that channel to tell it to open, to let in glucose. And that signal transfer is by dechirioinositol, a very special form of, we used to call it vitamin B8, then we found, which is inositol, but this is a special form. But we found out the body can actually make it, so it's not actually a vitamin anymore.
Okay.
Because you got to be a vitamin, it has to be something that the body can't produce.
And so it just helps the delivery of glucose to the
It makes
cells.
insulin much more powerful in its signal.
Okay. The next one is intracellular cell detox.
Okay. Another really cool supplement. So this is really based around things we call NRF2 activators, NRF2. That stands for nuclear receptor factor.
Okay.
So things that God built in nature, some of them get into the cell and they actually go to the nucleus and remember, turn on genes. And in fact, steroids, that's how they all work. So any type of steroid that your body produces or vitamin D or anything goes to the nucleus.
Okay.
So these are actually things that have nuclear factor capability. So they can turn on genes. So some of them can help you make more glutathione in your cells. Every cell in the body has glutathione. And if we can tell the cell to make more of its own, then that's great.
Yes.
We have other ones that basically help us with the protective mechanism of the cell.
Yes.
Okay. We have other ones that help with autophagy, making the cell more comfortable so it cleans itself better. And so in general, when we say intracellular detox, we're activating the things within the cell to assist that cell and the cells around it for getting rid of toxins and cleaning debris.
Yep.
And that's why we have it.
Okay. And the last one, which is a big one we talked about in this episode, is methylfolate.
Yeah. Huge chemistry. The base way I say it, it's not really perfectly scientific, but I like to say that basically folic acid's water soluble, but the nervous system and immune system, which need methylfolate, are covered in fat. How good do water and oil mix?
Not
Okay,
good.
so that's a little bit of a lie in the fact that it's actually a different transporter.
Okay.
And that transporter for methylfolate is called a solute carrier family. And basically, that transporter can only transport methylfolate. So methylfolate is the bioactive form of folic acid. And that actually helps us do several major things. It assists in the production of dopamine and serotonin. Okay. And remember, dopamine then converts to norepinephrine, which maintains your blood pressure and helps you with imprinting memory and all those other things. So it's a very important thing.
Yes.
Methylfolate helps us with production of our detox mechanism from glutathione and other detox things, which come from the methionine cycle. Methylfolate involves the Krebs cycle of the mitochondria to make energy. Methylfolate is involved in healing of all nerves. You know, when you're pregnant,
Yes.
you've got to take folic acid or the baby's nervous system. Well, you actually your body's converting it to methylfolate, and some women can't do that. We have to give them methylfolate.
Okay.
And then, so it's involved in an enormous amount, maybe as many as 100 different activities in the cell,
Wow.
depending on the cell that it is.
Wow.
Okay. So methylfolate is something that you've heard of, the MTHFR mutation.
Yes.
Okay. I like to say everything that's a folate deficiency is not an MTHFR because there's 4 enzymes above MTHFR that can be affected.
Okay.
Do you understand? So that's why I look at the whole pathway. But that's the same concept. If you don't have methylfolate, you're not going to feel as good. And without dopamine, you can't process sleep. Without serotonin, you can't relax for sleep. Do you understand? And so methylfolate plays a big role in not only repair of the body, energy production, but also processing of sleep and pituitary function and everything else in the brain.
Yeah.
Yeah.
Alrighty. I think that wraps up this episode.
All right. Big topic. Sorry, I'm just going off.
It's a long one. Alrighty. Well, thank y'all for joining us for another episode of Coffee with Dr. Stewart. Make sure you follow us on all of our social medias and be sure to put any questions you have in the comments, and we'll be sure to answer them in future episodes. Thank you and have a blessed day.
This show is for entertainment purposes only. Please do not use anything mentioned in this show as your own medical advice. Please discuss all medical issues with your own provider.